Okay, I've heard you mention PAT before, but what even is that?
Yeah, so PAT is short for psychedelic assisted therapy. And recently there's been a ton of interesting research into it as a form of alternative medicine to treat things like eating disorders, mood disorders, and even PTSD.
Oh yeah, a buddy of mine has been microdosing mushrooms to help with his PTSD. It can't be that effective with treating something like eating disorders, though.
Well, the scientists in Europe just conducted a scientific review on all of the current literature on the subject, and so far the research shows that psychedelics are a pretty effective alternative to treating eating disorders. The cool thing is that psychedelics open your brain and they invoke these profound psychological experiences, and it helps people who struggle with eating disorders change the way they see themselves and their relationship with food.
How does that happen? Aren't you just tripping?
Well, when you take psychedelics like psilocybin or MDMA, your brain increases its neuroplasticity, which starts to disrupt and change the brain's normal thought patterns and prior beliefs on oneself. So, if someone has negative beliefs and they think they're not thin enough or they're not good enough, those beliefs get broken down and allows people to see or even feel themselves differently. This allows for positive new connections to be built. There's actually this one really interesting case where someone who had anorexia used to see themselves as a rotting, decaying skeleton. But when they did an ayahuasca ceremony, they saw themselves as a full bodied, beautiful woman, which helped motivated them to start gaining more weight.
So it isn't just an emotional change. Psychedelics are actually rewiring people's brains and how someone sees themselves and their relationship with food.
Exactly. Psychedelics open a window for that kind of change, and with the right therapeutic setting, people can use it to rebuild healthier relationships with food, themselves, and even their bodies. Obviously, further research needs to be continued on the subject, but so far, a lot of the evidence is really promising.